So let's review really quickly what normal and abnormal lung sounds are. This should be a review of anatomy for you, but it's important to know as we start talking about disease processes. So there's 4 main lung sounds. What's important to know here is that each area of the lung should sound a certain way. And if it doesn't, we know there's a problem. So tracheal lung sounds, as you would expect, can be found over the trachea. They're harsh and hollow, kind of like blowing through a big pipe, which is exactly what the trachea is. Then you have bronchial breath sounds. These are heard over the bronchi, which is the main airways of the lungs. And they're usually heard right at the top of the sternum and below the clavicle, so somewhere in this area. They are high-pitched, they're loud, and they're also hollow, just a lot louder than tracheal. Then you have bronchovesicular. These are heard over the smaller bronchioles, and they can be heard kind of along the sternum. So these are not the tiniest airways, but smaller than the bronchi. You know, the trachea comes down and it splits, right? And then splits again. So when you get into those smaller airways, you're going to start hearing those bronchovesicular sounds. So what does it mean when we hear something different or nothing at all? We're going to cover the 4 main breath sounds you'll encounter, as well as talk about why they might be absent. The first is crackles. So crackles are a fine popping noise that are caused by fluid in and around the alveoli. So here's your alveoli. And if you get fluid in them, sometimes they get stuck or they get stuck closed. And when you take a nice deep breath, it actually pops them back open. And that's that popping sound that you hear. Now, the best way to mimic this is if you take a section of hair and you rub it between your fingers right next to your ear, you can hear what this should sound like. Now, if you have short hair, find a friend with hair you can borrow. Just be sure to give it back. So rhonchi are a harsh gurgling noise that are indicative of fluid or sputum within the actual airways. So you have your airway passages that go down to your clumps of alveoli. And if you've got fluid inside these airway passages, you're going to hear it gurgling as the patient takes a deep breath. It can even sound kind of like if you make a gurgling noise like in the back of your throat, like it's that sound. So it's liquid being pushed around in the airways. Now, rhonchi and crackles get confused sometimes, so just remember that crackles are fluid in the alveoli, which are the smaller parts of the lungs, so it's a smaller, finer sound, and rhonchi is fluid in the airways, so it's a more harsh sounding, louder sound. Now, one thing to note here is that lungs are like a sponge. If you've got a sponge and you get it soaked with water, right? Where's all that water going to go if you hold it up and down? The water is going to start falling to the bottom and dripping off the bottom, right? So if you have a patient who's sitting up and they've got fluid in their lungs, where's most of that fluid going to end up? It's going to be at the bottom, right? So when you're listening to their lungs, it's so important that you actually listen to the bases of the lungs, because if they do have fluid, that's where it's going to be, okay? Especially if they are bedridden. It could also be in any dependent area. So let's say your patient's lying flat and here's their lungs, right? Listen down here in the posterior area is where a lot of that fluid's going to go. So remember, the fluid's going to go dependent. So make sure you're listening to full anterior, posterior, and bases, and even on the sides so you don't miss it.